The story of James Boyd shows a history of physical and sexual abuse, followed by early run-ins with the law and growing mental health issues. His death at the hands of Albuquerque police officers sparked protests, as well as calls for more mental health services and a law that would require someone like Mr. Boyd to take medications or be put in a hospital. NMIF producer Megan Kamerick talked with officials from the National Alliance on Mental Illness and the UNM Department of Psychiatry about what can be done to ensure people get the help they need and law enforcement has proper training to deal with people who have a mental illness.
I'm joined here today by Dr. Mauricio Tohen, Chairman of the Department of Psychiatry at the University of New Mexico. Also, Felicia Barnum, she's the president of the Albuquerque chapter of the National Alliance on Mental Illness, or NAMI. And Cy Stanton, he's the program coordinator for the whole state for NAMI's Family to Family program. Thank you all for joining us. Dr. Tohen, I want to start with you. The fatal shooting of James Boyd and the subsequent protests have highlighted how often people suffering from mental illness end up in conflict with law enforcement. And the Metropolitan Detention Center, the MDC, is now the biggest mental health provider in the state. We could talk forever about this, but give us a thumbnail. How did we get to this point?
Well, this is certainly not unique to New Mexico. Most jails or prisons, the population has a mental condition. The figures go as high as 90%. So this is not unique to New Mexico. This is a problem that we're facing across the nation. I think we need to do more. We certainly need to work closer with the jail system because this would be in the benefit not only of those who suffer from a mental condition, but also it'll be a benefit to the community. So this is something very important for us.
And unfortunately, these have become sort of I don't even want to say providers, but intercessors of last resort, the police and the jail system, it sounds like, because we don't have the resources these people need.
Well, the officers are part of the team that is there to help those individuals who suffer from a mental illness. So that's why it's so important for them to be well trained, because they're going to face situations like this one.
Felicia, I want to turn to you. The National Alliance on Mental Illness has pushed for a version of what is known as Kendra's Law, or assisted outpatient treatment. What is this?
It is not involuntary hospitalization. It is a way to let the individual get the treatment that they need to keep them from going into incarceration.
But most states have this right now, Cy?
Well, she probably has the statistics on that. But
I think all but like
one of the things about AOT, if I understand it correctly, is, you know, a lot of times when individuals are released from a hospital after they've been, say, involuntarily there, a lot of times there's not any real good way for follow-up and to continue the outpatient treatment. It's just kind of they're out the door and they're on their own a lot of times. And I think the AOT, you know, would help solve some of that and help, you know, the families keep their loved one engaged with treatment after they've left the hospital.
Do you sense that there is support for this right now?
I do believe that there is support for this, and
among both people who have these afflictions and family members?
That I can't comment to, because right now we don't have a bill to look at.
Oh, okay.
So until that, if the bill that they present is in line with NAMI's national policy, then and supported that, then we would be able to give our support to that. And I also believe that with an AOT bill, the absolute goal has got to be recovery and quality of life. That's got to be, and I can't imagine anybody disagreeing with those goals. And to have that, the individuals have got to have good medical care, counseling, supportive housing, and also meaningful employment. We need employers who are willing to work with individuals who have a mental illness and understand that, you know, sometimes there's struggles, sometimes there's days they're going to be able to do great, and sometimes there's going to be days that are going to be challenging. But
like any of us.
Yes, absolutely.
Both of you have experience with relatives who
Yes.
have mental illness.
We have loved ones.
What has it been like trying to get them help?
Oh, boy. Her experience has been a little harder than mine, I suspect. You know, it was tough, you know, when our son was first diagnosed. Well, and the other problem is that getting a good diagnosis is always a problem. He had an initial breakdown and was hospitalized and got one diagnosis, and then, you know, that diagnosis changed over the years. But, you know, fortunately in our case, you know, we had at the time good insurance. He was on insurance. Once he turned a certain age, though, you know, that kind of went away, and it got a little more difficult. One of the things we found the last time was his insurance ran out after a certain period of time, and, you know, it's kind of like you're out the door when that happens, whether you're really ready to be out the door or not.
I see.
So that's...
What about you, Felicia? Are there enough facilities? Or, I mean, could you find a place?
He ended up going to one facility the first time. He's had hospitalizations on multiple occasions, and he's also had, you know, had interaction with the judicial system. That's not what you want for your loved one, but sometimes that's the only choice, and that's frustrating. The only way we can get help is through the judicial system.
What would help families like yours?
More resources, more facilities, more beds.
More beds.
Yeah,
More
I can
beds.
tell you from my experience when you know, there was one time when we had to admit him, and they almost didn't find a bed for him. I mean, they called every place they could find, and, you know, we thought we might end up having to, you know, drive him down to some place like Las Cruces or something just to get a bed. And I've heard a lot of family members, you know, in the class that I teach, have that same situation where, you know, they run up against a situation where there just isn't the room to put people sometimes.
I want to, you said there's not enough facilities. I want to go back to Dr. Tohen for a minute, because there is a push right now, interesting push by business leaders and religious leaders and mental health advocates, a coalition to push for a new behavioral health center in Albuquerque. What would this look like? Is it feasible? Is this something that you think we need right now?
That's certainly something that we're exploring, but I think it's important to keep in mind that inpatient treatment is just part of the treatment. That's for the most severely ill. We really need to think as a system of care where we have outpatient treatment, partial hospitalization, even the whole idea of the Kendra's law. It started in, I believe, in New York. An individual with mental illness pushed someone into the subway. And the argument here was that this person did not get treatment. So the idea was there to push to have the treatment, and even in some cases against the person's will. I think the important thing is to think of the assisted outpatient treatment as a partnership between those of us who provide care, the family, the patient. So it's really to help the patient. And the idea would be to prevent hospitalizations. One of the problems that we have is that many times when patients are discharged from the hospital, the outpatient treatment is not as complete as we would like. And that's going to lead to non-adherence to treatment and hospitalization. So I think when we think of should we build a new facility, I think we should think more as a whole. What are the services that our patients need? Is it inpatient? Is it outpatient? Is it partial hospital? Rather than just looking at do we need more beds or not. But it's certainly something that we're exploring.
From what I understand, this is the idea being pushed by this coalition is this kind of comprehensive idea. Do you think that there is political will and other will to get this done? Because we all know these have been issues for a long time. Now, with the shootings, with the protests, it's a hot item now to talk about.
Well, certainly the community is concerned about mental illness, concerned about individuals who suffer from mental illness. So there is certainly goodwill. And of course, this is our job, is to serve the individuals with a mental illness. And we know that when the community is educated about mental illness, the outcome is going to be better. There is stigma that gets on the way. As mentioned, there's lack of employment. So we see that the treatment of those with mental illness is, of course, to treat the condition, but also to educate the community. That will be more accepting and also deal with stigma. So we look at it in a very comprehensive way.
And the reality, of course, is that very few people with mental illness go on to commit violent acts.
Absolutely.
That's true.
Right? This is
Far more likely to
Yes.
be a victim of violence rather than commit an act of violence.
You both teach in this family to family program that NAMI does, the National Alliance on Mental Illness. What does that look like? You're helping families who have loved ones?
Yeah, basically, well, first of all, I'm doing this because I took the family class, my wife and I did, and for us, and I don't want to sound melodramatic about it, but it was a lifesaver. I mean, it really was. It's a 12-week course. It's very comprehensive. It helps family members, number one, understand these illnesses as real biological illnesses. A lot of times when people hear mental illness, because there's about 300,000 years of stigma attached to that, that suggested in the old, before probably 1970, that mental illness was a character flaw or bad parenting or something else. Well, now we know that these are
needed
biological,
exorcism.
these are real biological illnesses, just like you have a diabetes or heart disease or some other illness. It just happens to affect this organ up here. So we talk about that. We talk about the different medications that are out there to deal with different symptoms of these illnesses. We talk about the side effects. We also have a number of workshops in this 12-week class. A problem-solving workshop to help, believe me, family members who have a loved one with a diagnosis, they have a mountain of problems. We teach them how to sort through that and figure out what are the real important critical things, and then how can they go about getting some solutions to those problems that maybe they hadn't thought of, and expanding their community of support. We have a communications workshop to teach family members how to more effectively communicate with their loved one. Especially if someone is in a psychosis, you can't talk to that person necessarily like
Not
you would,
rational.
like you would, as if they weren't ill. And so it's not a panacea, but it's just we teach some methods of communication, and we actually have some workshops where we practice and do some role playing and that sort of thing. We also have a couple of points where we bring in guest speakers during this 12-week period. Someone like the doctor might be a guest speaker. We also have a group of individuals with NAMI called In Our Own Voice. These are individuals living with a diagnosis who are volunteers. They come not just to family, but to other locations around the city, and they talk to groups of people and tell their story from their perspective.
Felicia, this is great, and it's mostly for families who are encountering this. There's been a lot of talk about training police officers more effectively. The mayor wants them all to have crisis intervention training now, as I understand. What would that involve some of what you're talking about? Because it sounds like this would be very helpful for someone who is going to encounter someone with a mental illness. So they understand so tell me a little bit about what you'd like to see in terms of the training that law enforcement gets.
Well, one of the things I would like to see is the mindfulness training.
Okay, you mean like
that-
meditation?
Well,
Okay.
and learning how to, with the Hillsborough Police Department, they have a program that they are utilizing. And
Hillsborough
Hills in Oregon.
in Oregon, okay.
And they,
You brought this.
I
It's
did.
a magazine called Mindfulness.
It
It has
is
a
a-
police officer.
To Pause and Protect is the name
On
of
the
the article. And they learn about how the stress of their job affects their lives. And they're seeing people when they're not happy. They're always dealing with people who are miserable. And one of the quotes in the article says they're not trying to get rid of all the stress. They're not trying to be totally relaxed. It's a matter of being aware of the stress, where it's coming from, and how to move through it.
So is this an idea you're going to propose, NAMI?
I would like to propose this.
Okay.
Yes,
Okay.
that's my own.
One thing I would like to just piggyback on, if I may, regarding education, NAMI also has a program called Breaking the Silence,
Yes.
in which they actually have a curriculum that they provide to schools, and I think we've provided it to schools all over the state. I can't tell you for sure how many are actually using it, but I know several here locally are. But it is a curriculum to help students understand mental illness as real illnesses and that it's nothing to be ashamed of. And you know, it's just a really good broad curriculum to help teachers educate students about these
They go
illnesses.
into
To
high
help
schools.
break the stigma. Yeah,
They go into high schools and middle schools.
You were going to say something?
Yeah, I think the education of the police officers in terms of crisis intervention is very important. Actually, this morning I was watching TV and they were talking about a case where an individual put a gun to his head and the officer was able to calm him down. So there's some success stories.
We'd like to
There's
see
a-
that outcome versus
More
what
and
happened
more.
with
There
Mr.
are a
Ellis
lot
in
of-
2010 where he
Absolutely.
was killed.
Part of what we do in the Department of Psychiatry
We
is
have
that
about 1 minute, so.
we educate the public in terms of mental illness. Recently, we had a speaker to talk about violence, and I must say that the police chief and many of the officers were there. So we were very pleased with that.
I know we have much more to talk about. Will you all stay a little longer and we'll continue this on the web? Because I know we have some other things we want to talk about. Your upcoming mental health walk for NAMI
Go to
in May.
NAMIWalks.org.
Okay.
Click on New Mexico, find a team to join, help us raise some money, okay?
Be part
Okay.
of the solution.
All
Be
right.
part of the solution.
Thank you all so much, and stick around. We'll go on the web and talk a little bit more about this.